So Carolyn Bartlett, our kidney cancer UK counsellor, has very kindly come to share with us her experience and knowledge around counselling. So I'm afraid though we don't have a patient experience this evening, unfortunately due to unforeseen circumstances, but there will still be the Q&A after Carolyn's presentation. Okay, over to you, Carolyn.
Thank you very much, Hazel. So, counselling, who needs it? My intention today is to talk about how a kidney cancer diagnosis affects people psychologically and how counselling can help with this. This includes the impact of living with uncertainty. My name is Carolyn Bartlett, and I've been a specialist counsellor for Kidney Cancer UK and Scotland for about 6 years. I've always been interested in human behaviour and human resilience. My training started in 2014 following a personal experience that changed my outlook on life. I'm a registered member of the British Association of Counselling and Psychotherapy, and over the years I have worked with grief and loss, confronting death, baby and child loss, end of life, and living with uncertainty. Hope you can see that slide okay. Counselling is a talking therapy that involves a trained therapist listening to you and helping you find ways to understand and manage emotional and psychological issues. The relationship between the therapist and the client is unique and like no other relationship that you might have experienced. So this slide shows a frightened woman, but actually you might feel like you're coping well with your diagnosis. We are designed as humans to heal physically and mentally. Physical healing is visible and therefore easier to see. It is amazing how wounds heal, but our brains are harder to understand. We have coping strategies and defense mechanisms that allow us to cope. Counselling psychotherapy can help clients to feel differently. Processing your experience with a qualified therapist can help you come to terms with what has happened to you, to make sense of it at any point in your cancer pathway. At diagnosis or at a later point, sometimes it is only when the dust settles that we realise that we haven't fully processed the experience of surgery or treatment. So some signs that you might benefit from counselling are feeling alone, overwhelmed by everyday tasks, struggling with relationships with loved ones, isolation, and a lack of motivation to do the things that you would normally do. What kind of problems do people with kidney cancer experience? We have the shock of diagnosis. It's a loss of peace of mind, and it is a loss like any other loss. You are experiencing a grief process. Life isn't the same. It is unexpected. And coming to terms with having cancer, the very word and our associations of it create anxiety. The thought of having surgery, deciding on treatment options, emotional or relationship difficulties brought about by illness or treatments, the stress of adjusting to new treatments and side effects, and keeping to a treatment regime. So frequent visits to hospital can leave us feeling overwhelmed, anxious, or depressed. And you may have your own list of ways that you are impacted, and feel free to tell us about some of those things that you have experienced. So you can either put those in the chat box, or we can talk about it at the Q&A at the end. In simple terms, it is a threat. So how a kidney cancer diagnosis affects people, it's a threat to our existence. It's a threat to the life we know. Our brains are hardwired for survival, and our brain reacts in a primitive way to threat. We can become hypervigilant to the idea that we are not safe anymore. And this goes back to our early understanding of the world in childhood. We are born vulnerable, and it is the attunement with mother or our main caregiver that teaches us how we view the world around us and to regulate our emotions. So how we first responded to early events in childhood becomes the default for how we respond in the future. A kidney cancer diagnosis can trigger our brain back into a vulnerable childlike state where we wonder who is going to care for us. The NHS is under pressure, and clinical interactions can leave us feeling uncared for and abandoned. So fight or flight is a familiar term to most of us now. We all have a better understanding of how our brain reacts to perceived danger, the same way as it has always done since early man, by doing two important jobs. Our pituitary gland in our brain secretes the hormone cortisol, and the adrenal glands send out adrenaline. So these two hormones create an automatic response in the body by galvanizing our system to escape from the danger. Our hearts start pumping, pumping blood around the body. Our breathing becomes faster, a bit like mine is at the moment. Our breathing becomes faster and shallower. Our palms sweat. We can feel our heart pumping, and this in itself can be a frightening experience. So how does this impact us? Our sleep, digestive system, appetite and breathing can be affected. These are all part of our automatic nervous system, the things we do unconsciously. We do not have to think about them. When the automatic nervous system is affected, our feelings and thoughts can be very unsettling and physical. We can feel as though we cannot get enough air in, or there is a knot in our stomach. Intrusive thoughts, particularly at night time, and an obsessional need to have more information is something that comes up quite a lot. Equally, for some, an avoidance of information. Some people don't want to know what's going on. So feeling restless, cannot keep still, the mind is racing, desperate to have answers. And this can affect all parts of our life: relationships, jobs, friends, family, and our motivation to do things. So how does counselling help? So counselling provides a confidential space to talk to somebody who is not emotionally attached to you. It's a safe place to explore how you are impacted by your experience. We protect our loved ones from our deepest thoughts, and sometimes we ourselves do not want to think about certain aspects of our life. A counsellor can facilitate an exploration of how we are changed by a cancer diagnosis. And when we understand how our brains and bodies react to trauma, we can recognise our responses and be less fearful of them. The more we learn about our own bodies and brains, the better we can understand why we are reacting in this way. With understanding comes acceptance of the things that we cannot control. When we feel out of control, our brains can feel overwhelmed and our rational brain becomes inaccessible to us. We are unable to regulate our thoughts and feelings. When we talk about and explore some of these automatic responses, we enter into a new self-awareness and can learn new ways to manage and regulate our emotions. Things we understand are less frightening. Perception. So what we want is to take back control. A death threat in the form of a cancer diagnosis changes our perception of control. Suddenly we have no control. The fact is that we have always lived with uncertainty. As humans, we live life with an awareness of death, but death is something that happens at the end of our life when we have achieved all the things that we wanted to do. Exploring this with a therapist can help to clarify these automatic thought processes and determine outmoded or maladaptive ways of thinking. So how do we recognize anxiety? In order to manage it, how do we recognize anxiety within ourselves? Counselling can help you become more aware of how anxiety is felt in the body. Unconscious thoughts become feelings, which in turn can become behaviours. We are sometimes not conscious of certain behaviours we use. We're not conscious of certain behaviours that we use to try and settle our central nervous systems. My clients often tell me that they sit up all night researching statistics on their laptop, looking for evidence that is reassuring and not finding any comfort, looking for positives. In fact, it's exhausting and draining for the body and the mind. But this is a common focus when the brain wants answers. When the human brain doesn't know what is going to happen, we cannot formulate a plan or strategy in order to take back control. The brain is hardwired for survival, remember. We are designed to pay attention and hold on to negative information and feedback in case it helps us make an important decision about a life or death situation. We unconsciously discard positive information as this is not required to keep us alive. It is negative information that the brain looks for to hold on to. It is why newspapers and headlines catch our attention. Positives don't feel like truth. Negatives are easier to believe. So living with uncertainty, waiting for results, scanxiety, why is it so intolerable? So not knowing an outcome is difficult for human brains. We need to know what's going to happen next. Our brains are prediction machines trying to make sense of all the information available to us. The more knowledge we have, the easier it is to form a plan, a way to move forward. If we don't know what we are dealing with, how can we work out what to do next? It helps to recognize this within ourselves. Some clients rather, have told me that they just want to feel normal again, or when will I get back to feeling like myself? And they say that others still see me as the same, but I feel different on the inside. So our view of the world has been altered. I don't feel safe, I feel vulnerable and exposed, and I don't know what's going to happen next. Not nice feelings for humans. So there's counselling being offered, and lots of people are aware that counselling is a thing, but they might not know if it's a thing for them. And there's lots of barriers to accessing counselling. There's still a lot of stigma attached to seeking psychological help. It's also something else to organise and attend to on top of medical appointments. So some of the things that clients tell me, I've made a list here. And so, I'm sure there are people worse off than me, who deserve the counselling more than I do. So we tend to shut down something within ourselves, a need that actually we don't deserve it, or somebody else is more in need of it. So sometimes it's helpful to think about what the barriers are for you. I don't like talking about my feelings and emotions. It's not how we do things in our family. So this might be learned behavior, again, coming back to childhood, that, we don't ask other people for help. So there's lots of things here. I can't take time off work, feeling too unwell to access the counselling. I have childcare difficulties, concern that I might be seen as weak, feeling embarrassed or ashamed. And what if people find out I'm having therapy? So the idea that not only do I have cancer, but that I am also psychologically unwell. It's no wonder that we are overwhelmed by it all. So what to expect from counselling? The counselling we offer is a therapeutic, supportive and safe space for clients to feel able to talk confidentially about any issues that they are experiencing. There is no cost to this service. It is provided free of charge for up to 6 or 12 sessions, depending on counsellor availability. Sometimes only one session is necessary to process your story. Each caller is assessed to ensure their needs and expectations for counselling the idea is that, that an open conversation about what it is that you want to get, and what we can expect from each other. It is about the relationship. And during the assessment, you and the counsellor will decide a convenient time for the sessions to take place. Each session lasts for 50 minutes, 50 minutes, and is designed to support the client as best as possible through this emotionally turbulent time. This is beneficial. This is beneficial at any point in your journey. I hate that word, but you know what I mean. It is a process. Sessions are conducted over the telephone or online via Zoom, and sessions are agreed at the convenience with both client and counsellor. There is flexibility to encompass other commitments in life. Sessions can be weekly or fortnightly or even monthly. So, there are ways that we can make it work. The service is available to carers and family members as well as the patients themselves. So sometimes it's not always the patient themselves who need emotional support. Sometimes it's somebody close to you. And actually, as a patient, you might well be getting lots of support elsewhere, and actually it's a spouse or family member that needs the help. So bear that in mind. And this, we're coming to the end now. So I just want to thank you very much for joining us and staying on to listen. My usual role is on a one-to-one basis, as you can imagine. So talking about this to all of you is a rare privilege. I'm very happy to answer any questions that you may have on counselling. And I also understand that you may like to contact me in a more direct and private way, and my contact details will be made available to you. Please do get in touch with any queries that you may have, and thank you once again for coming to our webinar.
Thank you so much for that, Caroline. It was so interesting. I really like the bit about the negative and the positive, about why. I think as humans, we know that we always focus on the negative, but it's interesting understanding the why. We always seem to focus on the negative rather than the positive. But I found it very informative. So thank you so much.
Yeah, it is, like I say, that there still is a lot of stigma attached to counselling, and it is so personal. And like I say, I think it's important that people feel that they can contact me directly, maybe to ask questions. And it doesn't necessarily mean that they're signing up for the counselling. It's just being inquisitive. Not everybody needs counselling. Sometimes we can figure these things out on our own, and like I say, just one session can kind of work that out. Really, we can find out whether it would be beneficial for that individual.
Yeah. Oh, we've got a question come in. As a parent with cancer, what signs should we look for to identify in our kid if our kids need counselling?
That's a very good question. It is very worrying when you've got cancer yourself, and your children are trying to deal with all of that, and trying to look for signs. So children are incredibly perceptive. They know that there's something going on. So as far as I'm concerned, honesty is always the best policy. If we don't, it's always age appropriate how we tackle that with our children, but the more we're able to have open conversations about that, the less anxiety there is for the child. When we don't talk about it, when we try and cover things up, they actually become more hypervigilant and are more likely to get stressed out. So keeping those open conversations really, really helps.
Can you have more than one set of counselling, e.g. have one set and then say a year later have more if needed, if circumstances are different?
Yeah, so what I try and do, because there's different stages to your cancer pathway, and often initially it could be diagnosis and some surgery or treatment, but then 6 months later you've got a scan, or something else is happening. So it makes sense to be able to do that. So that is, so often initially we'll have 6 sessions, and then we can have another block of sessions or another few sessions in 6 months and even up to a year. So it's really how we pace that counselling. And again, it's about having that assessment at the beginning and talking about how you want it to work for you. So it's not about how it works for me, it's about how it works for the client.
Oh, so somebody just wanted to say thank you to Carolyn, as she's helped me personally overcome other issues in my life that a cancer diagnosis left me ill-equipped to deal with. So, okay.
Thank you very much for that feedback.
Yeah. As a long-term kidney cancer patient in remission, I am now concerned that symptoms are coming back. My last scan was good and I feel too old to start asking further help again. I am 77.
It's never too late to talk about your experience and how that's impacted you, and there is no age barrier to counselling.
So somebody said here, I contacted my local counselling, but found there was not any cancer counselling in my area. I am not depressed, but very anxious about what has happened to me and fear of it coming back, which it has done.
Get in touch, and we can have an assessment and talk through what, how counselling can help you. That would be absolutely amazing.
Yeah. Oh, there's just one. I would also like to say thank you to Carolyn for all the support she has given me and encourage others to get in touch with her. Well, thank you very much again, like I say, for everybody for joining us, and get in touch if there's anything that crops up. So we're here.
Please do get in touch.